So with the different types of lasers, as you can see here, the concept is there's a chromophore in the skin, or a target in the skin, and the target is blood vessels. And there are different types of lasers that are absorbed by the blood vessels. So if you use the correct laser and you use the laser in the right fashion, then you can destroy the blood vessel while safely protecting the skin without the risk of scarring. So there are different types of lasers that can be used depending upon the wavelength or color of light. Most of the work that's being done is in the 595 range. That's the pulse dye laser. There's more recent work being done now with the alexandrite, which is further out here in the 755 range, and where the red line is. And this is something that allows us yet another option in the treatment of these birthmarks. But most of the work that's done in my office and across the country is done with the pulse dye laser, which is yellow light laser. And the whole concept here is that you can get selective injury of the blood vessels. So here's the list of the different types of lasers that can be used. Amongst this list also are IPLs. There's some debate as to whether IPLs are as good as lasers. I don't feel that they are. Dr. Nelson would agree. But by and large, I think that the lasers that are selective for injury are the ones that are safe and certainly the most appropriate to use, particularly in young children where the risk of scarring is much higher. So what are the reasons we treat port wine stains? Certainly we all know that there are psychological reasons. No one wants to have this on their face. But there can be progression of port wine stains over time. And you can see that port wine stains begin as things that are flat and pink, become gradually redder over time, and thicker, as you can see here. And about 2/3 of all patients will get some thickening over time. Now, one of the things we learned is that the earlier lasers that we used were not as safe as what we have presently. It would cause some scarring of the skin and some loss of pigmentation more commonly than we would have liked. So more recently, with the development of selective photothermolysis, the ability to injure the blood vessel without injuring the skin has allowed for a much safer treatment to the point where we can now treat young babies days of age. And that's what we like to do, is to get the children into the office as quickly as possible. That's where we see our best results. Now, I know you're not scientists, but what we're looking at here, this is a large blood vessel that's just been damaged with the laser. This is the top layer of skin. You can see the laser's gone through the skin and injured the blood vessel without damaging the surrounding skin. And that's the basic premise of today's treatments, the fact that we can do this without worrying about injury to the skin. So the first laser, and the laser that's still used today for this purpose, is the pulse dye laser. And this is Dr. Rox Anderson's work out of Mass General at Harvard, where he designed this laser just for the purpose of treating port wine stains. And there are different types of pulse dye lasers. You can see here there are different wavelengths of light, and they're emitted differently to the skin surface. And also they're used in conjunction, in some cases, with either dynamic cooling. We use a cool spray with the laser, or air cooling where you're blowing cold air in the skin. The dynamic cooling was developed by Dr. Nelson, and I think it's one of the major advances in the treatment of port wine stains. It allows us to use higher energies, and it protects the skin from injury, so we get less scarring, and we can use higher energies so we get more improvement of the birthmarks. So basically this is what happens. You can see the bruising of the skin in the middle, with the redness around. In most cases we don't get scabbing or wounding of the skin after the treatment, and you can get significant clearing. We don't always get complete clearing. I'd say on average now we get approximately somewhere between 80 and 90% clearing with a series of treatments depending upon the location of the port wine stain and the age in which we begin treatment. So complete resolution is not always possible, but significant improvement can be obtained in many cases. And this is the dynamic cooling device that Dr. Nelson developed. The idea here is that you're delivering the laser, that's the yellow line there, and the blue is the cool spray that's delivered to the skin prior to each laser treatment. Very significant advance protecting the skin from injury and allowing us to use higher energies, which gives us a better result. Now, there's some debate, excuse me, as to what type of anesthesia or how do we protect the patient for the procedure from pain. In many cases, we use nothing. And in my practice, we like to begin treatment early on, during early infancy. In this case, it's not safe to use a topical anesthetic under the age of 1. It's not approved for that purpose. Local anesthesia would hurt as much as the laser treatment. And the face is so small, as we see with young babies, the treatments are so fast that the child recovers so quickly. The treatment itself is very short that you can get by with no anesthesia. As they get older in the office setting, we use a topical anesthetic. We use a topical cream, whether it be something called EMLA or Elemex. These are options. Sometimes we formulate our own topical anesthetic that might work a little better. And there are other cases where we'll give a local anesthetic for smaller areas, or we'll numb with some injections to numb the area. Or we'll give something called a nerve block. Let's say somebody comes in and has a port wine stain on the cheek. I can give a small injection here on the cheek and then I'll numb at least half the cheek with one simple injection. So it's a nice way to go. And of course, for many patients, young children, particularly working around the eye, or people who have larger malformations over a large part of the body, then we may choose to bring the patient to the hospital and do the procedure under anesthesia. And while this may be daunting to some patients and their families, I think in good hands the procedure was worked quite well, and anesthesia can be delivered safely and effectively. Complications in this treatment are rare. This is a paper we had published now 15 years ago, looking at 500 straight patients who came back to the office after having had pulsed laser treatments. You can see we had a very, very low incidence, no scarring. We did a little bit of atrophy and a little bit of loss of pigmentation. The atrophy all occurred in one day when we were using a new device that wasn't quite calibrated correctly, and all those problems occurred on one day and since been resolved. We've not seen that since. But in general, we do not see scarring in this procedure. It's a very rare event. One of the problems we do see is a dermatitis. Many of you who've had laser treatment will notice that you get this red inflammation of the skin that occurs. It can occur with port wine stains without treatment, but we see it much more commonly in port wine stains that are under treatment. There's some debate as to whether or not you should treat patients while they're taking a drug called Accutane. This is a drug that's used for acne. So some teenagers or young adults may be prescribed this drug. So we generally try to avoid treating port wine stains with lasers while patients are on Accutane, although this is just one case, and I'm not sure there's any real proof that's a bigger problem. So we generally do not see scarring, but it is something that can occur a little bit more commonly if someone's taking this acne drug called Accutane. Now, I know there's going to be a discussion later regarding the medical necessity of treatment of port wine stains, and I think one of the reasons that we give, and certainly the arguments that we make to the insurance companies, is that if you look at the number of patients who have port wine stains and look at the degree of thickening that occurs over time, you can see that 2/3 of all patients, really by the mid-40s, have some thickening of their port wine stain. It's my belief that if you treat early, you keep these port wine stains under control, this type of thickening will not occur. And this is a progression. This is a patient, the same patient over a 40-year period of time. Dr. Nelson commented yesterday when he saw this slide, wondering if I was old enough to have followed this patient. I am a dermatologist, so I have ways of looking younger, but no, this is a photograph, so a series of photographs that I found in a file. The patient subsequently came to me, and we put it all together to show the natural progression that can occur over time. In terms of how effective are these treatments, well, the results are all over the place. The published literature shows anywhere from a 40% degree of improvement all the way up to 100%. I don't believe the 100% story. I think that has been discounted. But I think a lot depends upon the site in which the port wine stain exists, the age in which you begin treatment, and of course, all this is evolving as we get better and better over time. Now, one of the important points that we've learned over time is that there are certain areas, anatomical areas, that do not respond as well, and areas that respond better. For example, the central portion of the face does not respond as well that compared to the forehead or the outside of the face, or even the eyelids do very well. But this central T-zone type area is much more resistant to treatment. And here's an example of a child who underwent 8 to 10 treatments, and this is years ago. We're certainly doing better than this now, with not as much improvement as we would have anticipated in other parts of the body. And the same thing is true on the body itself. where you can notice that the areas shaded in black respond much more slowly, below the knee, on the hands, below the elbow will do as well. But yet the central part of the chest and the abdomen and the upper back can respond beautifully, and the upper thighs will do well. And here's just an example of a patient of mine where you can see we clear the chest and the upper arm, but the lower arm remains in terms of the degree of the birthmark. We began treating young children early on, and this was our initial work, which is published with the scleral laser, using a yellow light at higher energies. And we did find some interesting results, and you can see here that you can treat these young babies, and very good results will be seen. Again, showing some differences in the anatomical location of the central portion of the face and the upper lip responding a bit more slowly. And there are cases where you do see complete clearing, but I think that that's generally within. The absorption of the laser light is also very highly different. A couple of years ago, we actually took some biopsies of these different types of lesions, and you can see that the geometry, and what you're looking at here is the red is actually the staining of the endothelial cells and the port wine stain. The green staining is actually for the neural tissue within the skin. What we have found is that there appears to be a congenital absence of that neural tissue in the affected area, which is why we believe that these port wine stains follow these dermatomal sort of types of distributions. So each one of these lesions is very, very unique, and this is what makes it often very, very difficult, regrettably, to give families an estimate of exactly how many treatments might be required to obtain the optimal therapeutic result. Not only are they very different, regrettably, we also know that port wine stains change in response to pulse dye laser radiation. And you can see that this was a lesion that was an adult, that was dominated by these very, very large blood vessels that you see on the image on the left. And then on the image on the right, after 3 months after pulse dye laser treatment, you can see that these very large blood vessels have been in fact destroyed, but regrettably they seem to have been replaced by this more network of smaller, more superficial sort of type of blood vessels.